Everyone can become a scholar. It requires dissemination. It requires just interest, perseverance, and dissemination. You have to disseminate in some way to build your own scholarship as an educator.
Scholarship in nursing education goes beyond research. It's about sharing what works. If you've tried something new, you've contributed. Dr. Marilyn Oermann offers practical tips for identifying and nurturing your scholarship over time. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Welcome. Today's episode shines a light on the nurse educator as scholar, a role that's often misunderstood yet deeply impactful. While many educators feel unsure about stepping into scholarship, the truth is your teaching innovations and insights are very valuable and they deserve to be shared. It's my absolute honor to introduce our guest today, Dr. Marilyn Oermann. Dr. Oermann is the Thelma M. Ingalls Professor of Nursing at Duke University and serves as the editor-in-chief of Nurse Educator. She's a globally respected scholar, having authored 34 books and over 230 peer-reviewed articles. Dr. Oermann joins us to demystify scholarship, share practical advice, and encourage educators to embrace their expertise with confidence. Welcome, Marilyn.
Thank you so much for inviting me. And I do agree with you. This is an area of our nurse educator role that people don't understand and they don't realize how important it is. So I do hope if I don't demystify it, I hope I at least explain it, at least my own view, and become really an impetus for faculty to do scholarship as they teach.
Yeah. So let's dive into the heart of the topic. So what does scholarship in nursing education mean to you? And why is it important for both the field and individual careers?
I think first I'll talk about what scholarship means. And I think it's really important for listeners to understand it's not only research. So a lot of times people equate scholarship with research, but it's much, much more than research when we think about nursing education. And so one of the ways to conceptualize scholarship, it does have a component. There is a type of scholarship that is more discovery. And, Boyer talked about it many, many decades ago. And that's true that people do studies and those studies produce new knowledge. We're discovering new outcomes. We're testing virtual reality and we're finding what it does and does not do. But I think that's just a tiny component of what scholarship is. Scholarship is also teaching innovations that you develop and share. It's also evaluations of new teaching approaches and initiatives that you share. It can't just be research because many of us teach in settings where there isn't no research mission, but you're still building scholarship. So I like to think about scholarship as the next time you develop a teaching innovation, you evaluate it and you disseminate it, you share. That is scholarship. And even if you don't have the evaluation component, a teaching innovation, a new approach that you share in the literature or at a conference even, that is a type of scholarship because someone can take those ideas, then the next person can implement it, basically rolling it out and adopting it, studying it, and looking at the outcome of that teaching innovation.
So kind of building on that foundation, I'd like to explore this next aspect. So why is it essential to share educational innovations? How does that dissemination contribute to the science and evidence base for teaching?
Well, I can answer that easily. If you don't disseminate it, there is no evidence. People don't realize that. If you are a really creative teacher and you develop all of these teaching approaches, you try them out in your setting, but you never share it, it doesn't build evidence. It's nothing. I should say it's nothing. It's good for the students and the faculty, other faculty to see you teach, but it does not bring and produce any sort of evidence. And I think an easy way to think about this is when you conceptualize evidence-based practice, what is it that we do in clinical practice? We do a study, we do a new intervention, we do a QI, but we build that knowledge and those outcomes and that understanding as we roll it out and we try it out in different settings. And Kelly does it in the Midwest, and I do it in the Southeast, et cetera. And as we do it more, as we adopt it in other settings, then we begin to develop evidence that people can really understand as educators that says, this is a really appropriate approach because 5 people have looked at it and the same outcomes occurred, whether you're within a small school, a large school, ABSN students, ADN students, the outcomes were the same. So without that building, adoption, and dissemination, I don't think there is any evidence that we're building. And, again, I mentioned when I answered your first question about scholarship, it has to be disseminated because that's the key piece to this. You can't build knowledge, you can't build new approaches if we don't disseminate it. And then the more practical one is if something doesn't work in your school, I want to know about it as a reader, so I don't try the exact same thing. So the other thing that dissemination does, it really helps you adapt the approach before somebody else tries it out. Either it took too long, it was too many resources. If people disseminate what they're doing, then if you think about implementation, you can modify your implementation based on what the last group of educators found. So I think it also has practical implications for us as faculty in schools.
So for the new nurse educators and they're learning about disseminating their work, where can they disseminate? How does that work? Can you kind of explain a little bit? Is it just in a peer-reviewed journal?
Yeah,
how else can they do that?
Right.
Yeah.
That's a really good question. Of course, I edit a peer-reviewed journal, so I see that. But if you look at dissemination models, actually, across the models, the broadest dissemination is peer-reviewed article. That is across all fields, not just health fields, all fields. The broadest dissemination is a peer-reviewed article. Because if you disseminate it in a journal that's in a curated database like PubMed, Medline, CINAHL, Scopus, Web of Science, and I go in the next day and I'm looking for that topic. I want to know what are people doing now, still with concept maps as an example. And I type concept maps in any of those databases, I'm going to find your article. So we think about dissemination as the broadest, in articles, the broadest dissemination. It's worldwide now because people find that information when they do a search. Moving down the dissemination model, then kind of a little bit lower than that is social media. So social media, it's good, it's fast, you can get a lot of downloads, but not everybody uses it. And for some of it, it's not available all the time. So, but that is the second. And then I like to, moving down a little bit more, then you have conferences. Conferences are a great strategy for dissemination. But think about a conference. The only people who hear about your teaching approach, your new ideas for evaluation and so forth, are the people sitting in the room or the people who come to your poster. And then the lowest level, which I actually think is a good way to start, is disseminating in your school. So if you're in a school where faculty talk about teaching innovations, where they share new ideas, if you have we used to have brown bag lunches. I don't know if we do that anymore, or brown bag Zooms, whatever it might be, as a way of sharing approaches. That's a really good way to start. It's small dissemination, but if they're colleagues you're comfortable with, they can give you ideas, ways to modify it, ways to study it. They can help you before you write an abstract for a conference, but it's the smallest really audience that you get for dissemination. I think it has to be in the literature. And, Kelly, the other thing people don't realize sometimes, thinking about scholarship, you don't have to write a 15-page article with 30 references that are research focused. A lot of the nursing ed journals publish shorter articles. They publish department articles. For Nurse Educator, for example, which is a Wolters Kluwer journal, so I can say this, we publish database manuscripts, research studies, manuscripts that aren't database. Like I just read one this morning on an academic practice partnership that was done in a rural setting to provide clinical experiences for students in schools in a rural area. And it combined inpatient, outpatient, and virtual. So just as an example, it doesn't have to be a research study. And for Nurse Educator, as an example, we also have short departments, 6 pages, 1,200 words, 4 references. You can write that in a weekend. You can write that in a Friday afternoon and get a draft at least. And then we also have these teaching strategies, teaching tips, 250 words. That's a really good way for an educator to share a new approach, to say, this is what I'm doing in my course, 250 words, no references. So the journals, and that's just one journal. Other journals have something similar. So it doesn't have to be this massive paper that takes forever to do within your busy teaching load.
Yeah, I think that is the mindset, is it's going to be this big, as they say, big dissertation, right? And it can be much smaller, but so impactful. So kind of speaking of dissemination, many nurse educators feel uncertain about whether their ideas are worthy of publication. So especially when you're starting out. So I guess my question to you would be, what advice would you give to those experiencing perhaps imposter syndrome?
Well, the imposter syndrome, it goes for all levels. So I think that's the first thing. When we use that term, and Kathleen Heinrichs had done a lot of writing early on about it, but the imposter syndrome, it's you have to build confidence, and build that confidence by starting small. If you have no publishing experience, write an abstract for a conference. If you have no publishing experience, write a short teaching tip or a short department article. Don't submit it to a journal that takes 5% of submissions. Find a nursing ed journal or a clinical journal that has educational papers that takes more articles, so it's a positive experience. Submit it for a conference where they actually will publish your abstract. So start small. I think that's the first thing. Listeners should also realize this whole notion of imposter syndrome, it happens at all levels. Like if you go into a dean's position, you have 30 years of experience, you'll have those same feelings. I know it happens for new educators. It also happens for new nurse practitioners. A couple years ago, we published actually a national study where the author was a nurse practitioner and used some sort of a standard tool that had been used to look at imposter syndrome. And he found new nurse practitioners felt the exact same way. So I think it goes across roles in nursing. I bet it does if you're a nurse manager and you've been a staff nurse for a long time. Start small, no matter what that is. Make it a good experience for yourself, and maybe begin at the conference level with writing an abstract.
So those who are just beginning their scholarly journey, do you have any practical steps maybe a nurse educator can take to start publishing their work and engaging in scholarship? I know you just mentioned quite a few. Are there any other tips or nuggets as they're just starting out?
That's a really good question. And the other thing I was thinking, we've been talking about scholarship in nursing education, using scholarship articles, evaluations, new approaches, as well as research to build evidence and the science of nursing ed. But as a faculty member, as a nurse educator, you can also publish on clinical topics. So let's kind of just switch a little and look, instead of scholarship for nursing education, scholarship for your career. And it doesn't have to be a short article or long article or research study for a nursing ed journal. Think about your work as an educator or a clinician. Let's say you're an adjunct faculty, or let's say you teach, but you practice 2 days on the side every month. Think about your practice knowledge and what you could disseminate. Because if you look at the journals in nursing, most of the journals are clinical practice journals. They don't get the wealth of submissions that the nursing ed journals are getting now. They want to publish articles about updates in new clinical approaches. I think that's another really good way to build scholarship as a nurse educator, as a faculty member. So it may not be the nursing ed, but it's scholarship that you're contributing to the literature in a clinical area. So as an example of a quick way, practical tip to get started, think about, if you're teaching a clinical course, think about a topic or content area in that course that you just added for this semester. You updated your course, you added some new meds, you found a couple new treatments, you found actually some new technologies that they're using in some center that you didn't know about it. You build it in your course. That content, then turn it around for a clinical journal. Write a short article for Nursing 2025. That's a Walters Clear journal too, so I can mention it. If you're a nurse practitioner, write an article for one of the NP journals. They write an article for the Emergency Nursing Journal if it's more acute care. A lot of those journals publish short clinical articles, and the journal editors want those new approaches. And a lot of the clinicians doing them don't have time to write. They don't think about scholarship because they're 150% in practice. So I think that's another really good strategy to get started with publishing your work. Next time you're working with your faculty group and you're obsessing about a new clinical evaluation tool, or we need to change this assignment, or maybe we need to build this new technology in our course, think about it with the idea that you're going to publish it. So don't waste your time even for educational topics. Think about this new approach, this new technique. You're going to build this new technology for your teaching. Start out with a lit review, where you're probably going to do it anyhow because you don't know much about that technology or that new evaluation form. Save the literature. Do a thorough literature review. Contact your librarian so you have search terms, like the number of articles you read. Save all that, because if your new approach, your new tool, this new technology really works well, at the end of the semester with your faculty group, you can say, let's publish this.
Yeah,
and you
beginning with that end in mind, right?
Absolutely.
Yeah.
But you have the lit review done. Somebody is going to record, because you need to know what you did to roll it out. Somebody can record that. At the end of semester, you have an article to publish. So I think the other practical tip, Kelly, that people don't think about, don't wait till the end of the year. Don't wait till the end when this project is finally rolled out. Plan it in the beginning, so you're basically working on the content, the substance of the manuscript as you're going along. Because I've done a lot of projects that at the end of one year, you think, I don't want to ever think about that evaluation form again. But if you map out the manuscript and you assign faculty in your little team what they should write about as you're going along, it's really easy to get the manuscript done at the end.
It sounds like just great intentionality. If you're thinking about it at the beginning, it's much less daunting, right?
Right.
Yeah.
And when you get the manuscript written, don't worry about the editing as much. A lot of times novice authors, faculty members, they write 2 paragraphs, they go back and revise it, they write another 2. Most of the writing literature suggests get the content down. Make sure it's clear, make sure it's well organized, make sure there's no gaps, and at the very end, do the editing. And if you have no idea where commas should be placed, if they just fly down from the sky, it's worthwhile asking somebody in your school who does more writing, will you take an hour and edit my paper?
Sure.
Most colleagues will do that, or pay an editor if you have to.
Let's talk about developing your scholarly identity. Can you share how a nurse educator may identify their area of scholarship and try to nurture it over time? You mentioned a little bit about clinical and some other ideas, but for those who are starting off and thinking, I don't know, what is my area of scholarship?
Yeah, I think that's a good question because you don't for your career.
Yeah.
Well, for building nursing knowledge as well, but for your career, you don't want to do one project in this area, one project on another. You want to build some expertise in an area. So my first tip is if you're starting out new, don't pick an area. Don't select an area of scholarship that there are hundreds of other people that do it. Find a niche. So I like to give the example of simulation. That's the largest area of research that we have in nursing education. Most of the studies are in nursing simulation. We have good studies, good outcomes, systematic reviews, meta-analyses, the highest level. If somebody says to me, Marilyn, I really want to build my scholarship in simulation, I'm going to say stop. What area? What hasn't been done? Because it's really hard now to break into some areas of scholarship where there's been people working on it for years. So find a small area, find something a little bit different that you're interested in, and then do your different educational innovations, your short articles, your presentations in that niche area or that smaller area. So when they think about clinical teaching partnerships, they think about you. When they think about rural nursing education, they think about you. Make your scholarship more focused, but don't start with an area that's very popular, say, and almost overdone in some areas.
As I thought about mine, I thought, what am I really passionate about? Do I have clinical expertise? And you started really discerning what topics kind of consistently inspire my curiosity, and you start diving into that literature, you start getting excited about certain topics. You look at opportunities to improve nursing education and practice, like you said, and really what challenges in those areas am I motivated to address? And that just really drove me as well. So,
right. Because you do want to be filling gaps in knowledge too.
Exactly.
So I think you've made that a really important point.
So kind of reflecting on your own journey, what challenges have you faced as a scholar in nursing education and how did you overcome them?
I think faculty in schools of nursing. So and this is probably true for professional development educators as well. The main challenge is time. Time. And it doesn't matter if you're in an LPM or ADN or BSN program or graduate program. It doesn't matter what school, nobody has as much time anymore. And, I hate to say, of course, they don't see my white hair, but they might notice me from other areas. People have more to do now than they did in years past. I've been teaching for a lot of decades. I can see the additional work that nurse educators face today that I didn't see in the 80s. There's more students. There's more courses people are teaching. There's more technologies to learn. There's a higher expectation for quality of teaching. So as the years have gone on, I think time is the major challenge. And then we've had a lot of studies recently about nurse faculty burnout, staff burnout, other areas of burnout, but nurse faculty and building resilience, you have to monitor your time. It can't all just be grading papers, preparing for courses, and writing your articles. I do think we have to balance time with personal time. So I think time is a number one challenge. And it even was for me years ago, because early on, novice educators, and it's probably true for a lot of people today, I used to teach theory courses and clinical. And those 2 days in clinical, you couldn't do anything except try to stay awake and get home on time. Or I had to run for babysitting. You have those kinds of demands. And we've had studies over the years that show clinical teaching is the most demanding for faculty. Well, often it's our novice educators that do a lot of teaching in the clinical setting. So just that workload balance is really a main challenge. I think you have to, two things, identify time in your schedule where you can do scholarship and block it off. It can't be a day, probably. A day, you'll be too tired anyhow. A couple hours, 3 days a week, let's say, or you can get a couple of hours, 2 days a week in the weekend. Block it off. but you can't run to the grocery store. You can't check email. You can't update PowerPoint for a class or a Zoom, and you can't walk the dog. You have to take those 2 hours, and you really have to dedicate it to scholarship. And it might be planning some evaluation of a really effective teaching innovation. The students loved it. The people you teach with said, this is just a great adaptation of whatever that up-teaching approach was, or different way for using virtual reality. Plan the evaluation, do the lit review in those 2-hour blocks of time, and then do the manuscript. And again, best if you can plan the manuscript when you start, but if not, one of the things I've realized over the years, sometimes novice educators spread the manuscript piece over a long period of time. They actually say to me, Marilyn, I'm going to write that article in a year. I think, a year? In 1 year, you could have another baby. You could break your leg. That is not even reasonable. 6 months isn't reasonable. So what I found with this time challenge is block the time, use the time, but make it a shorter time frame. So instead of 6 months or 3 months, look at your personal schedule, your work schedule. Try to get this done in a month. Because my own experience working with faculty has been the longer you spread it out, then you have more things that interfere. And scholarship isn't like getting to class at 9 a.m. or going to clinical. You can push it off. And that's what happens. So try to make the time that you get it done shorter and do nothing else during your 2-hour blocks.
An all-out blitz, just right, getting it done. Right. Absolutely. So, Marilyn, to wrap up kind of our conversation, I'd love for you to share a final spark with our listeners. So what one pearl of wisdom or inspirational message would you like to leave with the nurse educators aspiring to become scholars?
Everyone can become a scholar. It requires dissemination. It requires just interest, perseverance, and dissemination. You have to disseminate in some way to build your own scholarship as an educator.
Thank you so much, Marilyn, for sharing your wisdom and your experience. Your insights remind us that scholarship isn't reserved for a select few. It's a path open to every nurse educator willing to share, reflect, and grow. And to our listeners, we hope this episode sparked new ideas and renewed your confidence in your scholarly potential. Thanks again, Marilyn.
Okay, and thank you for asking me to speak.
Thank you for joining the Lippincott Spark, Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.